No cat owner ever wants to see their beloved cat in pain. Unfortunately, our furry friends are not able to communicate their discomfort directly. This means it falls on us, as responsible cat owners, to pay close attention and recognize these 15 signs they may exhibit when something isn't quite right. Number 1. Increased hiding. Cats love to find cozy spots to hide, but if your kitty is hiding more than usual, it could mean something is wrong. When a cat suddenly retreats to their favorite hiding place, they might be feeling stressed or dealing with an unseen illness that's making them uncomfortable. Number 2. Discolored gums. Your cat's gums should be a healthy, deep pink. If you gently press on them, they should quickly return to that pink color once you lift your finger. Gums that appear pale may indicate blood loss or poor circulation, as their color comes from the blood flowing just beneath the surface. If you notice bluish gums, it could signal a serious lack of oxygen, while bright red gums might point to overheating or toxicity. However, if the redness is primarily around the teeth, it could be a sign of dental issues. Always check your cat's mouth. It can reveal a lot about their health. Number 3. Dragging hind legs. One of the signs to watch for is if your cat starts dragging their back legs. If your cat, who normally zips around the house, suddenly begins to pull himself along with difficulty, that could mean something serious is happening. Sometimes cats can develop blood clots, especially if they have heart problems. If a clot gets stuck in their back legs, it can stop blood from flowing properly, causing pain and making it hard for them to move. You might notice him crying out or breathing heavily, and if you touch his paws, they may feel cold or look pale. If you see these signs, it's crucial to rush him to the vet. Remember, the sooner you act, the better the chance he'll be okay. Number 4. Struggling to use the litter box. Now, let's think about another scenario. Imagine you walk past the litter box and see your cat sitting there, looking frustrated. He's trying to go to the bathroom, but nothing seems to be happening. This could indicate a urinary tract blockage, which is a serious issue, especially for male cats. If they can't urinate, it can become life-threatening very quickly. A blockage can make your cat strain and seem uncomfortable, but no matter how hard he tries, he just can't go. This is a big red flag. If you notice this, don't wait. Get him to the vet right away. Number 5. Too many hairballs. One thing to consider is if your cat is having too many hairballs. When cats groom themselves, tiny hook-like parts on their tongues catch loose hair. Most of this hair makes its way through their stomach without a problem, but sometimes it clumps together and forms a hairball. Muffin might throw up an occasional hairball, and that's usually normal. However, if she's constantly bringing them up, it could mean something is wrong with her digestion. To help avoid hairballs, try brushing her fur daily and adding some fiber to her diet. It's an easy way to keep her tummy happy. Number 6. Coughing confusion. Now let's say you hear your cat making some strange noises. At first, it sounds like she's trying to vomit, but nothing is coming out. This could actually be coughing. Cats can cough for many reasons, like allergies or hairballs, but it can also signal something more serious like asthma or even heart issues. If she keeps coughing, it's time to call the vet. Number 7. Watch those pupils. As you keep an eye on your cat, notice her eyes. Cats' pupils change size based on light and their mood. If the room is well lit and her pupils are still wide, she might be feeling stressed or anxious. If they're unequal in size, that's a sign of a problem. It's important to keep track of these changes as they can indicate underlying health issues. Number 8. Open mouth breathing. Another concerning sign is if you notice cat breathing through her mouth. Cats typically breathe quietly through their noses, so if her breathing is loud or looks labored, it could mean she's in distress. If she isn't hot or stressed and is still breathing with her mouth open, this requires a vet visit. Number 9. Frequent vomiting. What about vomiting? While it's normal for cats to throw up occasionally, frequent vomiting is a cause for concern. It could be anything from eating something they shouldn't to more serious conditions. If Muffin is throwing up more than once a week, it's best to consult your vet. Number 10. Changes in appetite. You've just poured your cat's favorite kibble, but they sniff it and walk away. A sudden decrease in appetite can indicate various health issues, from dental problems to more serious conditions like kidney disease or cancer. If your cat refuses to eat for more than 24 hours or shows drastic changes in their eating habits, it's essential to investigate further. This could also be a sign of emotional distress, so keep a close eye on their overall behavior. Number 11, excessive drinking. If you see you're drinking more water than usual, that could be a red flag. Cats don't typically drink a lot, so if her bowl is emptying quickly, it might mean she's facing issues like diabetes or kidney disease. Keeping track of her drinking habits is key. Number 12, crying or yowling. If your cat starts crying or yowling, it can signal they're in pain. When you approach to pet them and they whine or shy away, it's a clear sign that something isn't right. Trust your instincts. This vocalization often means they need help. Number 13, grooming habits. Cats are known for their grooming, so if your cat starts to neglect her fur, it might indicate a problem. A scruffy coat or lack of grooming could mean she's feeling tired or unwell. If you notice her fur looking messy or dirty, it's time for a vet visit. Number 14, changes in your cat's sleeping habits. If you notice a change in your cat's schedule for when she talks or vocalizes and/or sleeps, there may be a medical issue. Call your veterinarian if you notice changes in behavior, such as pacing and talking overnight, or sleeping more during the day. If your cat seems confused or has a change in personality, call your veterinarian. This could be a sign of a medical issue such as feline cognitive dysfunction syndrome in an older cat. Whenever you notice something different, even subtle changes about your cat's behavior or habits, or when something is just not right, call your veterinarian. Number 15, stinky breath. Finally, let's talk about your cat breath. If it starts to smell really bad, it could be a sign of dental issues like gum disease or tooth decay. Regular dental care, like brushing her teeth and scheduling cleanings, can help keep her mouth healthy. By being aware of these signs, you can help ensure that Muffin stays happy and healthy. If you notice anything unusual, don't hesitate to reach out to your vet. Your furry friend relies on you to recognize when something is off, so stay vigilant.